201. A patient with type 2 diabetes asks why weight loss is recommended. What should the nurse explain? Answer: it improves insulin sensitivity and glucose control. Rationale: weight loss reduces insulin resistance, enhancing glucose uptake and lowering blood glucose levels effectively. 202. A patient with diabetes has a blood glucose of 750 milligrams per deciliter and altered mental status. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: altered mental status and extreme hyperglycemia indicate HHS, requiring for fluids, insulin, and electrolyte correction. 203. A nurse is checking a patient's insulin pump. What should be inspected regularly? Answer: tubing for kinks or leaks. Rationale: kinks or leaks in pump tubing can disrupt insulin delivery, leading to hyperglycemia, so regular checks are essential. 204. A patient with diabetes reports frequent urination and a blood glucose of 320 milligrams per deciliter. What should the nurse do? Answer: administer insulin as ordered and encourage fluids. Rationale: polyuria and hyperglycemia indicate osmotic diuresis, requiring insulin to lower glucose and fluids to rehydrate. 205. A nurse is teaching a patient about diabetic foot care. What should they avoid? Answer: cutting toenails with scissors. Rationale: improper nail cutting can cause injury, especially with neuropathy, increasing infection risk. Clippers or podiatrists are safer. 206. A patient with type 1 diabetes has a blood glucose of 270 milligrams per deciliter before exercise. What should the nurse advise? Answer: check ketones and delay exercise if positive. Rationale: glucose above 250 milligrams per deciliter with ketones increases DKA risk during exercise, requiring insulin correction first. 207. A nurse is administering insulin to a patient with a blood glucose of 88 milligrams per deciliter. What should the nurse confirm? Answer: the patient will eat soon. Rationale: insulin at a normal glucose level risks hypoglycemia without food, so meal timing must be verified. 208. A patient with diabetes asks about high-protein diets. What should the nurse explain? Answer: they can aid glucose control but need monitoring. Rationale: high-protein diets stabilize glucose but may stress kidneys and diabetes, requiring balanced intake and renal monitoring. 209. A patient with a blood glucose of 42 milligrams per deciliter is confused. What should the nurse do first? Answer: administer glucagon if unable to swallow. Rationale: confusion indicates severe hypoglycemia. Glucagon is needed if oral carbohydrates are unsafe due to altered mental status. 210. A nurse is teaching a patient about insulin pen maintenance. What should they check? Answer: the pen for air bubbles before injection. Rationale: air bubbles can reduce dose accuracy, leading to poor glucose control, so priming removes them before injection. 211. A patient with type 2 diabetes is prescribed canagliflozin. What should the nurse monitor? Answer: signs of genital infections or dehydration. Rationale: canagliflozin, an SGLT2 inhibitor, increases infection and dehydration risks due to glucose excretion in urine. 212. A patient with diabetes has a pressure sore on their heel. What should the nurse advise? Answer: offload pressure and consult a wound specialist. Rationale: pressure sores in diabetic patients can worsen rapidly, requiring offloading and specialist care to prevent ulcers. 213. A nurse is caring for a patient with DKA. What fluid is initially used? Answer: 0.9% normal saline. Rationale: normal saline corrects dehydration in DKA, restoring volume before glucose-containing fluids are introduced. 214. A patient with diabetes asks about sleep's impact on glucose. What should the nurse explain? Answer: poor sleep can raise glucose levels. Rationale: sleep deprivation increases stress hormones like cortisol, elevating glucose, so good sleep supports diabetes control. 215. A nurse is teaching a patient about sick day management. What if they can't eat solids? Answer: Consume carbohydrate-containing liquids. Rationale: liquids like juice or broth maintain glucose and hydration, preventing hypoglycemia or DKA during illness. 216. A patient with type 1 diabetes reports thirst and weight loss. What should the nurse assess? Answer: blood glucose and ketones. Rationale: thirst and weight loss suggest hyperglycemia or DKA, requiring glucose and ketone testing to guide treatment. 217. A nurse is preparing to administer insulin detamir. What is its onset of action? Answer: 1 to 2 hours. Rationale: detamir is a long-acting insulin with a slow onset, providing steady basal coverage over 24 hours. 218. A patient with diabetes has a blood glucose of 85 milligrams per deciliter at bedtime. What should the nurse suggest? Answer: eat a small snack with protein and carbohydrates. Rationale: a balanced snack prevents nocturnal hypoglycemia, especially with near-normal glucose levels. 219. A nurse is teaching a patient about CGM calibration. When should it be done? Answer: as per device instructions, often twice daily. Rationale: calibration with fingerstick glucose ensures CGM accuracy, with frequency depending on the device model. 220. A patient with a diabetic foot ulcer has fever and chills. What should the nurse do? Answer: notify the provider and obtain a wound culture. Rationale: fever and chills suggest systemic infection, requiring urgent culture and antibiotics to address wound infection. 221. A nurse is mixing regular and NPH insulin. Why draw regular first? Answer: to avoid contaminating the regular insulin vial. Rationale: drawing cloudy NPH first risks introducing it into the clear regular insulin vial, altering its action. 222. A patient with diabetes asks about preventing retinopathy. What should the nurse emphasize? Answer: strict glucose control and annual eye exams. Rationale: tight control slows retinopathy progression, and exams detect early changes, preserving vision. 223. A patient with type 2 diabetes reports fatigue. What should the nurse assess? Answer: blood glucose and medication adherence. Rationale: fatigue may indicate hypo or hyperglycemia or poor medication adherence, requiring glucose and history evaluation. 224. A nurse is teaching a patient about glucagon use. When is it indicated? Answer: for severe hypoglycemia with inability to swallow. Rationale: glucagon raises glucose in emergencies when oral carbohydrates are unsafe, such as in unconscious patients. 225. A patient with diabetes has a blood glucose of 165 milligrams per deciliter before breakfast. What should the nurse do? Answer: administer insulin as prescribed. Rationale: a premeal glucose of 165 milligrams per deciliter is elevated, requiring prescribed bolus insulin to control postprandial levels. 226. A nurse is teaching a patient about diabetic nephropathy prevention. What is key? Answer: control blood pressure and glucose. Rationale: hypertension and hyperglycemia accelerate kidney damage, so tight control reduces nephropathy risk. 227. A patient with type 1 diabetes has vomiting and a blood glucose of 360 milligrams per deciliter. What should the nurse do? Answer: test for ketones and notify the provider. Rationale: vomiting and hyperglycemia suggest DKA, requiring ketone testing and urgent medical intervention. 228. A nurse is teaching a patient about insulin injection angle. What is recommended? Answer: 90 degrees for most, 45 if thin. Rationale: a 90-degree angle ensures subcutaneous delivery, but 45 degrees prevents muscle injection in lean patients. 229. A patient with diabetes reports leg numbness. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: numbness is a common sign of diabetic neuropathy caused by nerve damage from chronic hyperglycemia. 230. A patient with hypoglycemia is alert post-treatment. What should the nurse provide? Answer: a snack with protein and carbohydrates. Rationale: A balanced snack stabilizes glucose after hypoglycemia, preventing recurrence until the next meal. 231. A patient with type 2 diabetes is prescribed allogliptin. What is its action? Answer: enhances insulin secretion via incretin effects. Rationale: allogliptin, a DPP for inhibitor, increases incretin levels, promoting glucose-dependent insulin release. 232. A nurse is teaching a patient about balanced meals. Why are they important? Answer: they stabilize glucose and provide nutrition. Rationale: balanced meals with carbohydrates, proteins, and fats prevent glucose spikes and support overall health. 233. A patient with diabetes has a blood glucose of 820 milligrams per deciliter and confusion. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: confusion and extreme hyperglycemia indicate HHS, requiring urgent fluids, insulin, and electrolyte management. 234. A nurse observes a patient injecting insulin too shallowly. What is the risk? Answer: poor absorption and hyperglycemia. Rationale: shallow injections may not reach subcutaneous tissue, reducing insulin absorption and causing elevated glucose. 235. A patient with diabetes asks about fasting for religious reasons. What should the nurse advise? Answer: consult the provider to adjust medications. Rationale: fasting can cause hypoglycemia or hyperglycemia, requiring medication adjustments to maintain safe glucose levels. 236. A nurse is caring for a patient with DKA. What sodium imbalance is common? Answer: hyponatremia due to osmotic shifts. Rationale: hyperglycemia draws water into the bloodstream, diluting sodium, causing hyponatremia, which requires monitoring. 237. A patient with type 1 diabetes missed their morning insulin. What should the nurse monitor? Answer: hyperglycemia and ketone levels. Rationale: missing insulin leads to glucose and ketone buildup, risking DKA, necessitating close monitoring. 238. A nurse is teaching a patient about preventing nocturnal hypoglycemia. What is key? Answer: check glucose and eat a bedtime snack if needed. Rationale: monitoring and a balanced snack prevent low glucose overnight, especially if evening levels are near normal. 239. A patient with diabetes has dry, itchy feet. What should the nurse advise? Answer: moisturize and avoid scratching. Rationale: moisturizing prevents skin breakdown, and avoiding scratching reduces infection risk in diabetic patients. 240. A nurse is reviewing a patient's glucose log with low afternoon readings. What should the nurse explore? Answer: excessive lunch insulin or activity levels. Rationale: afternoon hypoglycemia may result from too much insulin or increased activity, requiring dose or lifestyle adjustments. 241. A patient with type 1 diabetes has a blood glucose of 580 milligrams per deciliter and reports abdominal pain. What should the nurse prioritize? Answer: assess for diabetic ketoacidosis and notify the provider. Rationale: abdominal pain and severe hyperglycemia suggest DKA, a medical emergency requiring immediate assessment and provider intervention. 242. A nurse is teaching a patient about insulin lispro, Humalog. What is its peak action time? Answer: 1 to 2 hours after injection. Rationale: lispro, a rapid-acting insulin, peaks in 1 to 2 hours, aligning with postprandial glucose rises, requiring meal timing coordination. 243. A patient with type 2 diabetes has a blood glucose of 55 milligrams per deciliter and feels clammy. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia in an alert patient requires 15 grams of fast-acting carbohydrates, e.g., glucose gel, to raise glucose, with rechecking after 15 minutes. 244. A patient with diabetic neuropathy notices swelling in their ankle. What should the nurse advise? Answer: elevate the leg and seek medical evaluation. Rationale: swelling may indicate injury or infection, worsened by neuropathy's poor sensation, requiring elevation and prompt assessment. 245. A nurse is preparing to administer insulin detamir to a patient. What should the nurse know about its administration? Answer: it should be given at the same time daily. Rationale: detamir, a long-acting insulin, provides consistent basal coverage when administered at a fixed time, optimizing glucose control. 246. A patient with diabetes reports blurred vision and a blood glucose of 410 milligrams per deciliter. What should the nurse do? Answer: administer insulin as ordered and monitor vision changes. Rationale: blurred vision is common in hyperglycemia due to lens swelling. Insulin corrects glucose, and monitoring tracks symptom resolution. 247. A patient with type 2 diabetes on metformin reports bloating. What should the nurse suggest? Answer: take it with meals or discuss extended-release options. Rationale: taking metformin with food reduces GI side effects like bloating, and extended-release forms may further improve tolerance. 248. A patient with diabetes has a blood glucose of 48 milligrams per deciliter and is irritable. What is the nurse's priority action? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia with symptoms like irritability requires 15 grams of carbohydrates to raise glucose, followed by rechecking. 249. A patient with diabetes finds a small cut on their foot. What should the nurse teach? Answer: clean it daily and monitor for signs of infection. Rationale: small cuts in diabetic patients can lead to serious infections due to poor healing, requiring diligent care and monitoring. 250. A nurse is teaching a patient about insulin pump therapy. What should the patient report immediately? Answer: pump alarms or delivery interruptions. Rationale: alarms or interruptions indicate potential insulin delivery failure, risking hyperglycemia or DKA, requiring immediate action.